names are Dr. Anselmi Onyango Opiyo. I'm the head of department, the Cancer Treatment Center here in Kenyatta National Hospital, but I also do consultation outside the hospital, other private hospitals. I'm also the chief medical specialist in the area of cancer. The treatment of cancer, is treatment that involves many areas of medicine, and it involves many experts. The treatment of cancer has to be diagnosed in the first instance, which means a patient who suspects that they're having cancer would have gone to a doctor, and the doctor would suspect that there is a problem of cancer, so they would send them for some investigations in form of x-rays. They would probably also take some tissues or some blood. Out of these tests, the patient will be diagnosed to have cancer. And after that has been done, the patient will then be referred to the relevant expert in cancer. Further investigations are normally carried out in form of blood, in form of x-rays, and very complicated tests are normally carried out just to type the kind of cancer you are dealing with, to determine the extent of the cancer that is afflicting the patient. This is important because, before you start treating a patient as a cancer specialist, you must know what stage of disease it is. We have running stages from 1 to 4, and we know that stage 1 and 2 cancers, the cure rates are very high. You're talking of over 90% cure rates. Stage 3 and 4, these are a little bit advanced. They are actually not a little bit. They are advanced cancers. That is stage 3. When you are reaching stage 4, the cancer will have disseminated to other areas. So then the doctor, the cancer specialist, will always be investigating a patient with these stages in mind. That will help him to determine the form of treatment that they are going to administer. So they might decide that this is disease that is localized, in which case I only want to give radiotherapy, radiation treatment, or I want to give radiation treatment and chemotherapy, at different times. Or the doctor might decide that you are getting radiotherapy and chemotherapy at the same time. If the patient is to say now, the patient is to go to a radiation oncologist, this is now a doctor who specializes in cancer treatment using radiation. The radiation oncologist is radiation treatment of cancer with radiation is a localized form of treatment, which is directed on the site where the cancer is. So there's quite a bit of complex planning that needs to be done before the patient starts on radiotherapy. The doctor, the radiation oncologist, would send this patient to an equipment. He will be sent to a center where there is a scan, which is a planned scan. It's a scan that is used as part of planning for the radiotherapy. In other words, before you start radiotherapy, you have to plan on how the treatment will go. So the patient will go to a planning scan, or what we call a CT simulator, a CT scan which can simulate the treatment that you want to give. So the patient will be placed in a treatment position. That area of interest will be scanned, and the information that comes out of that will then be passed on to the radiation oncologist, who will sit down with another specialist, somebody called a medical physicist, who will then, with the doctor who does the radiation, they will be sitting down. They will map out the area that needs to be treated. Once they have mapped out the area that needs to be treated, you will then be able to use the computer systems to direct beams of treatment in a simulated way. You are actually simulating the treatment, and this treatment is given to you while you're lying down in the same treatment position. That is why technology is important. When I'm simulating you and I'm putting you on the machine, it has to be exactly the same. The error margin should be less than 0.05% on how I treat the area I'm treating you every other day. So every day you'll be lying in the same position. Every day I'll be using laser beams to put you in the same position. Every day I'll be securing your head, if I'm treating the head region, in the same direction. And this treatment goes on every day for between 5 and 8 weeks. Short treatment, it takes less than 2 2 minutes most of the times. If you are giving the standard dose of what we call 2 grays, it takes less than 2 minutes. But there are equipments which can give even less amount of time. I mean, you can give treatment in less amount of time than the 2 minutes. We are facing a lot of challenges when it comes to treatment of cancer using radiation. For one, for a long time we did not have facilities with the appropriate equipment that could treat cancer appropriately. Not long ago, less than 2 years ago, the only treatment center was here. This is the Cancer Treatment Center in Kenyatta National Hospital. We were the only ones who were able to give radiotherapy, and the equipments that we were using were cobalt machines. You can use cobalt units to treat certain areas with no major concerns, but we know that if you are to treat special areas like, say, the brain, or if you are to treat areas near the eyes, if you are to treat the abdomen or chest, if you have deep-seated cancers, then you need other machines which have better penetration power. They have better alignment. You can actually align the tumor in a better way without affecting other tissue. And this is where now we have gone a step further. We are now using linear accelerators. So linear accelerator is a new form of radiation emitting equipment that are being used all over the world. But even the linear accelerators, so when you go to a department of cancer radiation department, you will always find a range of equipment. You will find that there is a cobalt unit, there is a linear accelerators, and even the linear accelerator as the modern equipment, there are various types. There are others with higher energy, there are others with less energy. And apart from linear accelerators, you can go even further to other equipments called gamma knife. You see, these are even more advanced equipments. Treatment of cancer using radiation involves many specialists. It's not just the doctor who is a radiation oncologist or what we normally refer. Like, I am a clinical oncologist, meaning that I can give both radiotherapy and chemotherapy. My training is not just radiotherapy. Okay? So if you are to train a clinical oncologist, for that matter, he or she needs support of other personnel. The person who is going to administer radiation, who is called a therapy technologist, has to be trained. We also don't have enough of those personnel. We've just started a school now to try and train those people, but up to recently, everybody had to go to abroad for that. You need the services of somebody called a medical physicist. This is a physics, somebody who has done ordinary physics but has gone and done the masters in medical physics. In other words, only to see how radiation, their function, their work is to see how radiation will enter the body. So you also need those kind of people. We don't have any such training in the country. They have to be trained in abroad. You need what we call dosimetrists, who are the people now who do the planning. We don't have those kind of people. They have to be trained in abroad. We also need the services of our radiation safety officers. Even those ones have to be trained in abroad. So the challenge of manpower is quite serious in the country. We only have 4-5 radiation oncologists in the country. Radiation effects, again, are a range. Okay? But what we call very serious radiation effects, we are talking in terms of between 5 and 10% of serious side effects, which tend to occur between 0 and 5 years when you're getting treatment. So radiation is safe, except that about 5 to 10% of the patient experience side effects, serious side effects. The radiation specialist must, and I'm emphasizing that, he must put it clear to the patient what are the effects that they are bound to experience, so that the patient makes an informed decision. And that is why we always ask for a consent. The doctor does not have a formula of knowing whether you will be one person who will not get major side effects, okay, from that person who will get major side effects. So if you just remember that the side effects are to the range of about 5%, you're getting it. And if you're talking of side effects, it is always good also to remember that the side effects are divided into 2 groups. There are those acute side effects and long-term side effects. Acute side effects are the ones which take place at the time you are going through the treatment. Those ones are not of any concern. They are not worrying in the terms of the long term. But they are the ones which make the patient unwell during that time. But fortunately enough, they are temporary. They are temporary side effects. You see something like feeling like vomiting, something like feeling dizzy, something like feeling that you've got ulceration in your mouth. These are normally temporary side effects which don't have a bearing on the long-term side effects. So surely when you're going through the treatment, the temporary side effects are quite disturbing, but they have got also solution to it. We put you on medication, but they're temporary. They are not long-term, okay? Such that when you experience them, they are only during the time when you're getting radiotherapy. After that, they wear out completely. If it's ulcers in your mouth, they disappear. If it is feeling like vomiting, that disappears, okay? And you don't experience them later on. But the long-term side effects are the ones which should be quite of concern. Cancer as a disease, the causative factors are multifactorial. Apart from genetic, infections can cause, cancer of the cervix, is caused by human papillomavirus. That's a viral infection, okay? Genetic, we have a lot of genetic cancers. Like here, we see a lot of small children with cancers of the eye. You see that some disease that we call retinoblastoma. We know that is hereditary. In other words, you see in a family, you'll find about 20 to 50% of the children are affected by that cancer. If you are smoking, you see, if you smoked more than 25 cigarettes for over 20 years, there is a likelihood that you'll definitely get cancer. Are you getting it? Of the lung. Not only that, but smoking itself is responsible for causing many types of cancer. Cancers in the mouth, cancers in the throat, cancers of the stomach, cancer of the bladder, cancer of the breast. They are all smoking, cancer of the lung. They are all smoking, related to smoking. But you have other substances like asbestos, the building material, that used to be used before. I don't know if they're still using them. You see, again, this dust from that definitely causes cancer of the lung. When you are exposed to a particular component of the asbestos itself, there's most asbestos dust. Look at aflatoxin. You see, you have heard about substances in food. Okay, we know that there could be some toxins which are also in the type of foods that people eat. Are you getting it? It's only that now aflatoxin is like the fungal toxic substance that is produced by a fungus called Aspergillus flavus. It itself is a precursor of getting cancer of the liver.